Most of them have lost their job. You come to the facility, you are tied down till in the evening. And so HIV plague the poor more. The poor suffer more when it has to do with HIV. That's one. Then two, the attitude of some of the healthcare workers is an issue. People come and they're like begging. So what they do in most of the facilities, for me, I would say, is they're dispensing drugs. Because HIV treatment is not supposed to be like that. During the era of Doctors Without Borders, MSN, we enjoyed it. You come to the facility. Before you come to the facility, you are called upon. You are doing what we call tracking. You are called upon. How you are doing? Why we didn't see you last week? You come to the facility, you leave to the facility relieved. Everybody cares about you. It's no longer the case. You come to the facility now, once you're seated with the doctor, the first question is your payment, your money for the user fee. Some facility pay to see doctors. Some facility pay, say, 1,000 to see doctor, 2,000 to pick up drugs. The checkup, the vital sign, 5,000, which is done every 6 months. So if you multiply all of this in dollars, that will tell you that it's not a little amount then compared to the number of people who come around to access treatment. So our people are also defaulting because most, not some, has resulted to faith, waiting on God to cure them, that they can't pay. If they die, they die.
Now, what you're telling us now, is it the same across the countries of West Africa? The same situation?
In Nigeria, that I know, it's critical.
Well, you say international community.
Yes, in Nigeria, that I know, it's critical. After this user fee was attached, our people are feeling treatment. Before now, TB was not an issue. It was almost curbed. Now our people are beginning to develop TB.
The user fee is 1,000 or 2,000?
To see doctor in some facility. So it varies.
In some facilities. So what's the average fee?
You can say 5,000 monthly.
Monthly, that's what...
It's not cheap for an unemployed person. It's not cheap.
Unemployed because employers of labor don't want to employ people living with...
That's another issue. If you apply after the test, on discovering that you are positive, they give you some excuses that they get back to you. We've had issues like that, and they never get back to them. We are seen as less human. Can they really work? I've been living with it since 2004, and I've been coping. Not easy though. But what our people are going through now, it has never been like this. After they attach this user fee issue, to pay for their user fee, particularly the widows, a widow that has, say, 4 or 5 kids to take care of herself. Some have even 2 or 3 kids that are infected, who lost their husbands, and the whole burden is on the woman, caring for herself and then the children. Okay,
let me ask the question. This situation now, you're of an international organization, the West African branch.
West African.
Is this situation across West Africa?
It is, particularly in the communities, rural areas. In the rural areas, it's even much more than what I'm talking about. In Lagos, at least, you can see some treatments. In the rural areas, it could be maybe 1 or 2 facilities around.
All right, we'll take a moment, and when we return, we'll be asking Dr. Falola, what about the attitude? She's talked about attitudes and issues of survival. We're back in a moment. Please don't go away.
See all hands on deck. And
for 4 days, representatives of the federal government, development partners in the health sector, and networks of people living with HIV and AIDS converged on this hall to celebrate the 2016 World AIDS Day in Abuja. The Director General of the National Agency for the Control of AIDS gives the current status of the virus and the challenges he faces trying to control its spread.
Almost 1 in 10 people living with HIV globally are in Nigeria. About 600 people acquire the infection every day in our country. Now is the time to tackle the challenges of inadequate domestic funding, shrinking donor support, a weak healthcare supporting system, and a poorly coordinated national response.
However, the country director for the United States Center for Disease Control explains how much the American government has invested in treatment and care for HIV in Nigeria.
Nigeria, since 2003, has received almost $4 billion to address HIV prevention, care, and treatment. The results so far are encouraging, but we are not satisfied.
Meanwhile, the secretary of the network of people living with AIDS in Nigeria decries the lack of access to medication by his members.
We have less than 1 million that are under ARV treatment. We have a long way to go. Nigeria accounts for 3.5 million people living with HIV and AIDS in this country. We have to fast-track antiretroviral therapy.
The Minister of Health, represented President Muhammadu Buhari, assures of government's commitment to fund HIV prevention efforts while appealing for prudent use of resources.
I'm aware of the challenges that have arisen in the last few years with regards to the delivery of HIV services in the country. I hereby reaffirm our commitment of ensuring accountability and transparency in the HIV sector.
The minister then proceeded to launch the national guideline for the treatment and control of HIV and AIDS in Nigeria.
Dr. Yinka Falola Anomwa, Ms. Morrissey has talked about several things. One of the things she mentioned had to do with the impact of the attachment of a user fee, how it's affecting them negatively. Then she said something which I quite picked up, and that had to do with the attitude of some health workers.